Hi, my name is Dr. Hope Mitchell, and I am a board-certified dermatologist practicing in Perrysburg, Ohio. So this year at the American Academy of Dermatology, I had the opportunity to talk about online reputation and management, and it was a very important topic that is very near and dear to my heart. And although I dropped a lot of gems, a couple that really resonate with me is the fact that online reviews are growing. And it is how people are finding dermatologists, physicians across the board. And the reviews are really reflecting interpersonal cues. They're not reflecting competence. People are not walking away and saying, I loved Dr. Mitchell. She did a great job on that biopsy. They're really talking about how you made them feel. So reputation is all about how you make people feel. Do you respect them? Do you have empathy? Are you listening? Are you explaining so that they understand, right? Is there that connection? And then I also talked about the importance of workflow, right? People want to come to practices where they feel welcomed, where the staff are friendly, where scheduling is easy, right? Billing, there's not any concerns about that. So those are the things that I talked about. And one last gem that I'll drop is review response. It's important to respond to all reviews, positive or negative. They can have your responses great impact because not only are you responding to the person who wrote the review, but you're leaving a response that other people coming to your reviews will read. So in social media education as a dermatologist, we're still fighting for proper education, correct education. We don't mind information being out there, but when it comes to our field, dermatology, we want it to be accurate. And so a lot of us are coming to social media because we want our patients to know the truth. We want them to understand their conditions, understand information. And so that's why I think it's really important that we dermatologists get out there. Well, AAD, I have been practicing for 27 years and I've never missed an AAD since I finished residency in 1998. This is a big meeting where we can connect with our colleagues, we can make new friends, we can learn new things. I always go to the American Board of Dermatology table to make sure I'm compliant, and so I stop there. I go to a lot of symposiums. One of my favorite areas of operation, I'll call it, is alopecia. So that's a subspecialty that I love to treat, and I have learned a lot about advancement in technologies and treatments for alopecia. So the education is top-notch. The interactions and the ability to meet new people globally is top-notch. You leave here tired, but we can deal with that when we get home.